In this video, we look at Unit 2, Key Area 8, Subsection C, Type 1 and Type 2 diabetes. We will look at the differences between Type 1 and Type 2 diabetes, when they tend to develop, how they tend to be treated. We will look at, in both cases, what diabetes does to blood sugar concentration. We'll look at the role of the kidneys in removing some of the glucose and how that historically was used to test for diabetes. A slight sidebar is that diabetes mellitus, which is the proper term for it, means sweet urine. So when your kidneys got particularly overloaded and started pushing the sugar out in your urine, which you're not supposed to do, doctors could taste your urine and diagnose you with diabetes. Lovely. So we'll learn about the link between blood glucose levels and obesity, and specifically type 1, type 2. We've covered some of this already. Today we are looking at the differences between type 1 and type 2 diabetes. So diabetes mellitus is a failure to control the blood glucose levels and an impaired ability to store that glucose in the form of liver and muscle glycogen. So type 1, type 2, you might already know a little bit. This is just a little summary. So the onset of type 1 diabetes. So type 1 diabetes tends to occur in childhood. A person with type 1 diabetes is unable to produce insulin and can be treated with regular doses of insulin. So what I've just read out is the SQ you need to know, and you can see it perfectly matches this mind map because I made this. So type 1 diabetes, just to summarize it so you can get fuller notes, a person with type 1 is unable to produce insulin and can be treated with regular doses. In terms of type 2, again, I'm going to read from the SQ you need to know. Type 2 diabetes typically develops later in life, so it tends to be the adult form. The likelihood of developing type 2 diabetes is increased by being overweight. You see there's other arrows. The body becomes resistant to insulin. This decreases the production of insulin receptors in the liver and leads to a failure to convert glucose into glycogen. So in onset adult, we have being overweight quite often causes it, but just being old can, eventually your body just gives up. So your body becomes resistant to insulin. More specifically, the cells of your body become resistant to insulin. The receptors no longer work. It decreases the production of insulin receptors in the liver, so you won't be storing your glucose as glycogen in the liver, and that means a failure to convert glucose to glycogen. Diet and lifestyle changes, you can get a lot of people going back to a pre-diabetic stage. Really, there's not a lot of treatments. There's lots of drugs you can take for it though. So this is just again summarizing what we have talked about, so you can pause that and copy it down if you want. So classic symptoms of diabetes, this is a little bit of a sidebar. This is not really part of the course, but you can listen, it's interesting. Most of these things have a scientific name that starts with poly, like polydipsia, polyuria. People say that they have an unquenchable thirst. No matter how much they drink, they cannot kind of undo it, and they have unquenchable urination as well. So peeing a massive amount. A lot of people will say they'll lose weight, which is why there's certain times people will lose a lot of weight with diabetes. Other symptoms can include fatigue because your cells aren't getting the glucose they need, blurry vision. You don't necessarily want blurry vision. We talked a bit before about blood glucose levels and peripheral vasculature, peripheral nervous issues. Diabetes is not particularly good on your eyes, your circulation, things like that. Gum and urinary tract infections and slow wound healing. So bacteria like sugary wounds, basically. So complications include things like, as I've said, nerve damage, vascular diseases, hypertension, so high blood pressure, strokes. So a lot of this is linked to atherosclerosis and the throwing off of clots, so silent heart attacks, strokes, things like that. You can get quite nasty damage to the eyes and lose things like limbs and sight and things. People with diabetes need to be worried about diabetic ulceration. There's lots of things that contribute to diabetes, especially type 2. We've talked about them here. Again, it's not really part of the course. So, in both types, this is part of the course. In both types of diabetes, blood glucose levels will rise sharply after a meal. So the kidneys will remove some of the glucose. Glucose shouldn't really be getting into your pee as much as this. So it's quite a good way to test for diabetes by dipping someone's urine, looking for glucose. You can do what's called the glucose tolerance test. So the blood glucose levels, so again, I'm going to read from the need to knows. The glucose tolerance test is used to diagnose diabetes. The blood glucose concentration of individuals are initially measured after fasting. So if you want to know if someone has diabetes, you don't yet know, you say, right, well, don't eat anything for the next few hours, and then you test their blood sugar. So you know their starting blood sugar. The individual then drinks a glucose solution. So you used to have to know the exact concentration of glucose, don't anymore. And then their blood sugar is measured with a finger prick for at least the next 2 hours. So you measure it regularly for the next 2 hours. You should see the blood sugar levels dropping. The blood glucose concentrations of a diabetic will start at a higher level than a non-diabetic because before the test, they've not been controlling the glucose well. During the test, a diabetic's blood sugar will increase to a much higher level than a non-diabetic. When you have a sugary drink, your body, your pancreas, immediately notices the blood sugar level going up and starts to produce that insulin. So a diabetic sugar will start higher and it will get much higher and much quicker than a non-diabetic. It'll take longer to return to its starting concentration as well. So they have some level of control. Their cells can still access some of the glucose, and the glucose levels will eventually drop back to what it was before the test. But that level will still be higher than a non-diabetic, and it will take a lot longer. Quite often, as I was about to say, you will get graphs like this in the test. So it shows that the diabetic's blood sugar level starts higher, climbs quicker, stays higher, and then takes a very long time to get back to normal. So this is a good diagnostic test. If someone goes in, maybe a child goes in, and the parents think they have diabetes, you can do a glucose tolerance test, and if they start at a reasonable level, it climbs, but then within 2 hours it goes back to normal, then they're probably fine. If it starts quite high, goes up quickly, and stays high, then they probably have diabetes. Okay, so again, this is just a wee summary thing for what we learned. Blood glucose sugar rises after a meal, and excess sugar is excreted through urine. The testing and diagnosis in general for diabetes, the presence of glucose in urine is good. The glucose tolerance test, blood glucose levels are measured after fasting, so not eating for a while. And then, as I said, you used to have to know the numbers, again, for 2 hours after drinking the solution. So you can have a go at these if you want. So someone with type 1 diabetes, see which one you think these it is. Type 2 diabetes, which one is it? A person with type 1 diabetes, person with type 2, person with type 2, person with type 1. And this would be the answers. Type 1 diabetes occurs mainly in childhood. Type 2 occurs later in life. A type 1 person is unable to produce insulin. A type 2 person produces insulin, but the cells are less sensitive. A person with type 2 is treated first with changes to diet, weight, and exercise. There are some medications. And a person with type 1 is treated first with regular doses of insulin. We will look at subsection D in the next area, which is the last, I believe. It's the last part of the course, isn't it? So it'll concern obesity.